So Uganda had its first case of COVID-19 on March 21st. And from there on, a few days, we had announcements about banning gatherings, social gatherings, markets, and public transportation. Then later on, a few days, we had a lockdown, really, people staying in and not going to work, and only essential workers staying on the job. So there's also a ban, like people cannot easily move between different cities in Uganda, and the concentration is in the capital. So most of the cases have come from people who came from outside, mainly via Dubai. So they are trying to trace those, and we have over 50 cases right now, and we haven't registered any deaths so far. So, but the country is supposed to test over 17,000 people who came in actually who are not quarantined. So there's still a high risk of finding many cases, and they're testing every day. Apart from the health issues where the different teams are working on the testing, and the testing is able to be done here, we have issues like healthcare for other diseases, since they've banned transportation. So a lot of pregnant women are unable to reach their hospitals. A lot of economic impact, of course, is being felt, because a lot of people really live from day to day, whether you make money today, so you spend it tomorrow. So to be unable to actually go to work here affects millions of people. So we are seeing definitely a parallel crisis, economic crisis, with the COVID crisis. And the government is yet to give us any tangible economic measures, but in terms of health-wise, they're trying so hard to track and test the cases. So far, we still have just slightly over 50 cases. So the impact really is being felt economically, because people cannot go, and we hope that it can be contained, because our healthcare system is not really up to that level where we can handle that many cases. We are already in this country, the leading killer disease is even malaria. So in such cases where healthcare facilities are not able to function as usual, and they don't have testing kits, it's becoming so difficult for people to access medical care. So we worry about people dying actually from other diseases, not COVID, because that actually is a very big risk, as we see that the disease burden of the country.